I'm Demetra,
I'm Elyssa.
and we're going to be presenting on laryngeal massage. So we wanted to start out by mentioning all the different terms that are synonymous for laryngeal massage. Laryngeal massage is also known as circumlaryngeal massage, paralaryngeal palpation, or laryngeal manipulation therapy, as well as other terms. We just wanted to mention it in case when you're out practicing as a clinician, you may want to find some additional resources or do your own research. And we just wanted to make sure that everyone's aware that there's multiple different terms for laryngeal massage, but they mean virtually the same thing. So what is laryngeal massage? It's a manual technique that lowers the larynx and reduces laryngeal muscular tension. This increases vocal fold mobility. It increases vocal fold mobility, and this helps us adjust length and tension. So this promotes healthy vocal fold vibration. It promotes vocal fold abduction for breathing and can also assist with swallowing. We know that myofascial release is a buzz term that you may be seeing in continuing education or other resources like SLP forums that you might be looking at. So we just wanted to differentiate between the two. Laryngeal massage is not myofascial release. Myofascial release is a type of massage that specifically places pressure on the body's fascia or connective tissue, and you need specific additional training to perform myofascial release. Laryngeal massage, as long as you know how to do it, you can perform it on your patients. You don't need specific training, but you do need special training if you want to perform myofascial release. Next slide, please. Thank you. So who should use laryngeal massage? Laryngeal massage is primarily used with patients who have muscle tension dysphonia, otherwise known as hyperfunctional dysphonia, as well as patients experiencing symptoms of vocal fatigue, vocal aches and pains, hoarseness, and needing to use an increased effort to project and make their voice louder. A special population that can use laryngeal massage is professional voice users, considering that professional voice users can often experience muscle tension, fatigue, and other factors from overuse. It makes sense that they would be a target population for laryngeal massage. We wanted to mention that laryngeal massage is a technique that can be used inside and outside the therapy room. It's not like something maybe like SEMG biofeedback where you're really just doing it in therapy, you need special tools. That's not the case with laryngeal massage. Typically during a treatment program, the SLP will perform it on the patient to help ease symptoms in that moment and when they're in the therapy room. But then they also teach the patient how to do it themselves so they can add it to their toolbox, so to speak, of things they use that help their voice. We also wanted to mention that many professional voice users like to use laryngeal massage as a warm-up or cool-down technique for their voice, just like how someone who runs might have stretches or massaging that they do as a warm-up and cool-down. Professional voice users like to use laryngeal massage as a warm-up or cool-down. Next slide, please. So current research on laryngeal massage, a 2009 pilot study showed positive evidence for laryngeal massage as a therapy technique to treat excess muscle tension. Participants' speech formants or acoustic energy were analyzed before and after receiving laryngeal massage. Researchers measured formants because of the source filter theory, which we did learn about in the anatomy lecture with Professor Mitchell, but just as a review, the source filter theory says that formants are altered due to changes in vocal tract length, and ability to change the vocal tract length can be affected by laryngeal height. So this is why researchers decided to pick it as a way to measure laryngeal height. Researchers found that formants were lowered after treatment, showing evidence that laryngeal massage was able to lower the larynx and increase vocal tract length. We also found a 2021 meta-analysis done by Kim and colleagues that reviewed 10 papers to investigate the effects of laryngeal massage on the voice. A 2021 meta-analysis done by Kim and colleagues reviewed 10 papers to investigate the effects of laryngeal massage on the voice. The study found that laryngeal massage relaxed and lowered the larynx, which improved vocal fold mobility and adjustment of vocal fold length. By improving vocal fold physiology, the patient's vocal range was expanded and the patient's vocal quality measured by jitter and shimmer was improved. So this was also a really interesting finding in the study that supports that professional voice users can really benefit from laryngeal massage, because let's say you have a singer who is suffering from loss of vocal range, you can introduce laryngeal massage and that may help expand their vocal range again.
We also found a study in 2021 that was an experimental study done by Doss and colleagues, which included looking at 10 females with MTD, and the results were measured using the GRVAS to measure hoarseness, harshness, and breathiness while sustaining vowel ah production. The study compared results between pre-therapy, immediate post-therapy, and assessment data from a week after given laryngeal massage therapy, and they found that LMT helped to improve shimmer immediately following the MCT. And they also found that breathiness was improved after laryngeal massage therapy.
So before we head into our demo of how to use laryngeal massage, we wanted to go over some just general tips. So first, you want to see if the patient may be a good candidate for laryngeal massage. Are they experiencing those symptoms of muscle tension, tightness? Do they feel pain? If so, where do they feel it? Do they feel like they need to exert a lot of effort to get their voice out? We'll also want to gather our typical case history information, such as typical day of voice use, what makes their voice feel better or worse, what they wish to achieve with voice therapy, as this will also help us decide if the patient is a good candidate for laryngeal massage. While we're taking a case history and establishing rapport, we want to slowly introduce the topic, ask, have they heard of laryngeal massage? Maybe have like other voice clinicians trialed it with them, things like that. We really want to get patient permission before we do laryngeal massage because it's a sensitive area, and we want to make sure they're comfortable with us touching it. And once we have patient permission, we want to explain what we're going to do and how it's going to feel. Once you have patient permission for the laryngeal massage, it's a good idea to try it during your intake meeting or for first appointment. Just like how you might trial compensatory strategies during a bedside swallow eval, we also want to trial certain voice therapy techniques to see if they may be effective before we start working on a treatment plan. If laryngeal massage is going to be a big part of your treatment plan, but then the patient ends up discovering that they really hate like the feeling of someone touching their larynx, then we're not going to want to include that in a treatment plan. It's also important to note to be careful when you're touching the sides of the neck during the laryngeal massage, because that's where our carotid arteries are located, and our carotid arteries are the major blood supply to the brain. So you want to check in periodically with your patient, see how they're feeling. If they feel dizzy, lightheaded, or nauseous, discontinue the massage immediately.
Now I will be going over 4 different types of massage demonstrations, starting with the overture. So you're going to first start by putting your hand on the opposite side of your neck, and then you're going to want to put it underneath your jaw and massage in circular motions, moving down to your clavicle, and do this about 2 to 3 times. Then you're going to want to put your finger at the top of your throat, and you're going to pull the larynx to one side, and then you're going to turn your head to the side and hum. So you're and while you're doing this, you want to make sure that you're doing each of the treatments on the opposite side that you did the previous treatment. The next one is going to be the trios. So you're going to place your thumb and forefinger under your chin, and you're going to slide it back towards your ears. And you're going to want to repeat this a couple of times, probably 2 to 3 times. Then you're going to want to do the same thing where you're going to want to go from the larynx down to your collarbone, like this, and do this about 2 to 3 times. Then with one hand, you're going to want to place on one side of the larynx, one finger, and then on the other side, the thumb underneath your chin. And you're going to want to go down in circular motions, moving down the side of the larynx, and do that about 2 to 3 times. Then you're going to repeat from the larynx. You're going to go back a little bit and do the same thing, making sure that you emphasize pulling up a little bit. And you're going to want to do that 6 to 8 times. The next one, you're going to take 3 fingers on either sides of your larynx, And you're going to want to push them side to side. And you're going to want to allow your mouth to open a little bit slightly. And there should be no resistance when you do this. Then you're going to press your thumb underneath the center of your jaw and throat. And you're going to lift your tongue up and feel that tongue lift. And you're going to hold for 20 to 30 seconds. And while you do that, you want to release slowly when you are done. Now the last one, you're going to either sustain a hu, ho, ha, or he in full voice. And you're going to want to pull down with your fingers close to the midline. So, hu. Then doing the same syllables, you're going to want to push gently in and out, starting from the midline to the outer part of your throat. And then you're going to want to push after doing that a couple times. So you're going to want to do like this. Ooh, ooh. And you should be hearing a pitch change, and you want to do that for 2 to 3 seconds. Next, this is going to be a video of some of the demonstrations that I showed done by an SLP from Columbia University.
All right, so we're going to be talking about laryngeal massage. Now, if you think of your voice as if you were a runner running a marathon, we know that marathon runners benefit from a warm-up and a cool down of those muscles after they've been used so extensively. It really can support recovery after an extensive use of the voice. And one of the ways we can do that is by actively palpating and massaging the muscles of the throat. So I've got our giant version of the larynx here. And we're going to use the Adam's apple as sort of like a anchoring point to find the structures of the throat. So everyone can find their Adam's apple, or for those of you out there, an Eve's apple if you prefer. You're going to take your pointer finger and your thumb, put it on either side of that Adam's apple or the larynx, and you're going to massage in circles to start. Now, everybody asks me, how much pressure should I use? And we don't want so much pressure that you feel any sort of sharp pain. But enough pressure to change the color of your fingernail seems to be pretty appropriate for most people. So we're massaging in that circle. As the first stretch, you can stay here for 30 seconds to a minute if you like. Then we're going to move just an inch above to this U-shaped hyoid bone. And we're going to massage front to back along the horns of this bone. So Adam's apple, move above to that U shape, and then massaging front to back here. Again, 30 seconds to a minute. Then we're going to take both our thumbs and we're going to press up underneath the tongue. If you want to intensify this stretch, feel free to stick your tongue out of your mouth. And you can work your way up and down the edge of your jaw with that stretch. Finally, we're going to take 2 or 3 fingers, put it to one side of that Adam's apple, and then we're going to gently press it over to the opposite side. And to intensify the stretch, we can turn our head in the opposite direction. Remembering to breathe as you do all of this. We'll hold it for 30 seconds to a minute and then repeat with the other side. Remembering to breathe again. All right, and that's the 4 basics of laryngeal massage.
And these are our references.
Thank you so much for watching.